A properly collected blood culture sample free of contaminants can help ensure accurate results that will improve patient outcomes. Gather all necessary materials. Bottle lot number, expiration date, fill to mark, barcode, black box, window for checking the level of blood. Ensure that the culture bottles are within the expiration date. Do not use a bottle which contains medium exhibiting turbidity, a yellow sensor, or any other visible defects. These may be signs of contamination. Do not use bottles which show any signs of damage, deterioration, or leakage. Wash your hands with soap and water and then dry them, or apply an alcohol hand rub. Prepare the collection materials in a clean, protected area to help minimize contamination. Before starting the collection procedure, be sure to confirm the patient's identity. Check that the laboratory form and labels match the patient's identity. Remove the flip caps from the blood culture bottles. Disinfect using an approved disinfectant. Use a fresh swab or applicator for each bottle. Remove the swab or applicator and allow the bottle tops to dry completely. The arm is the recommended site for drawing a blood culture. Place a disposable underpad under the patient's arm. Locate the vein and apply a disposable tourniquet. Then palpate to locate the vein. Wash your hands with soap and water and then dry them or apply an alcohol hand rub. Then apply well-fitting, non-sterile examination gloves. Disinfect the chosen venipuncture site using an approved disinfectant. Up to 30 or 60 seconds, depending on the disinfectant used. The venipuncture site is not considered aseptic until the disinfectant has fully evaporated. Assemble the syringe and needle. Do not repalpate the prepared vein before inserting the needle. Enter the vein swiftly. Blood appearing in the syringe confirms a successful venipuncture. Release the tourniquet as soon as blood starts to flow, and always before it has been in place for 2 minutes or more. For adult patients, collect 20 milliliters of blood with the syringe. For pediatric patients, a special pediatric aerobic bottle may be used and inoculated with up to 4 milliliters of blood. Remove the needle from the vein gently. Cover the puncture site with a suitable dressing. Apply pressure. Discard the needle in a sharps container safely. Attach a safety transfer device to the syringe. Inoculate the anaerobic bottle first. Use the fill to mark to accurately gauge the sample volume, 10 milliliters per adult bottle. For pediatric patients, you may choose to use a unique pediatric aerobic bottle. Once the anaerobic bottle has been inoculated, remove the adapter cap. Repeat the procedure for the aerobic bottle. If other blood tests are required, always collect blood cultures first. Mix blood culture bottles, invert 3 to 5 times. Discard the syringe and adapter in a sharps container. Dispose of other materials. To properly label the bottle, use the dedicated area on the bottle. Place the barcode labels vertically so that the orientation is the same as the bottle barcode. Ensure that any additional labels do not cover the bottle barcode. Place bottles and blood collection tubes in a biohazardous plastic bag and request form in an outside compartment. Transfer the inoculated culture bottles promptly to the testing laboratory. 3 important points to remember in regard to blood culture collection. First, proper disinfection is crucial to ensuring a contamination-free culture. Second, sufficient blood volume will help ensure optimal organism detection. And third, transfer the inoculated bottles promptly to the testing laboratory.